America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, 221 affiliates strong. Thanks to all of you in the listening audience. Our newest affiliate, KYST-AM in Houston, Texas, Houston, Galveston, actually. Very happy to have them on the air. Very happy to be down there and be part of that family. We're on Saturdays from 7 a.m. to 8 a.m. We're very happy. I want to thank Matt Vasquez, who put us on the air down there, and they are now part of America's Healthcare Advocate family. And I know you're listening because I've already gotten phone calls. That when the first show ran, I got phone calls right after the call on Saturday, of the show on Saturday. So I know you're listening, and we thank you, and we're happy to have you on board in Houston, Texas. All right. Our producer today, Mr. Darren Wilhite. He is the man behind the microphone. The man behind the cameras is David Thiessen. He is our video producer who does all the podcast platforms and all the rest of it. If you want to follow us on Facebook, Twitter, LinkedIn, or any of the rest of the social media platforms, it's America's Healthcare Advocate. The website is americashealthcareadvocate.com, americashealthcareadvocate.com. If you've got questions or comments, send me an email. I get a lot of emails, but I do answer each and every one of them, and I am happy to answer any questions you may have, or if you have suggestions for the show, like the gentleman from Houston did a couple of weeks ago. Again, we're happy to hear from you, so go to the website, americashealthcareadvocate.com. All right, joining me in studio today, Dr. Troy Burns and Dr. Angela Prato from ProPartners Healthcare. It's been a while getting this show put together. Also happened off camera here, sitting in studio, is Heidi Williams, and she's the practice manager, and thank you for pulling all this together, Heidi. So welcome, doctors. I've known you for a long time vis-a-vis radio, doctor.
Yeah.
Because you're not new to radio.
Indeed.
And doctor, welcome to the show.
Thank you.
So we're going to talk about a different model of primary care today. You know, one of the things I try to do with this broadcast is educate and inform. And you're going to hear some things here that are going to be very, very different. The way they deliver healthcare, it's an alternative. It's something different. Okay. And I'm intrigued by it, and I think you will be too. It's a model that obviously is working well because they continue to expand the number of clinics they have here in the KC Metro. And doctor's been doing this a long time. We'll talk a little about his history with this here in a minute. But we're happy to have him on board. So let me tell you a little bit about Dr. Burns. Dr. Burns is an author. We actually have his book here, which we will show you now. Right there is Dr. Burns' book that he has published, which is called Medical Answers Now, which is kind of interesting because we don't always get medical answers now. Dr. Burns is a practicing primary care physician and the founder of medical director of ProPartners Healthcare, Kansas City's leading primary direct care medical service practice. He received his medical degree from the University of Missouri at Kansas City in 1986 and completed his internal medicine at St. Luke's Hospital. Dr. Angela Prato joined ProPartners Healthcare in 2018. Dr. Prato spent her initial college education at Emporia University in Kansas, and she attended the University of Oklahoma's undergraduate studies, attained a Bachelor's of Science degree in zoology, biomedical degree, and a minor in history and science. She graduated from the University of Kansas Medical School in 2015 and completed her family medical practice. She is a board-certified family medicine member, and she is a member of the American Academy of Physicians. Thank you both for being here.
Thank you for having us.
So it's this happy time of year. We've had 15 degrees below zero, the fourth coldest game in the history of the NFL, when the Chiefs played their playoff game against the Dolphins. And people are, and I told you off camera, I just went to Indianapolis, Chicago, and Omaha all by air because driving was not possible. And needless to say, I came back with an issue. I came back with bronchitis. Whether it's flu, bronchitis, RSV, or COVID. Doctor, why is it important for people to pay attention to this now? And probably a little more important for those of us that are chronologically challenged, seasoned citizens, to pay attention to this in this particular environment in the winter.
So we've had quite a respiratory season this year. It's been pretty intense with one virus after another and bacterial things on top of that. And access is a major issue for a lot of people. And so when we have patients who aren't sure, is this something I need to go to urgent care or ER, our goal is to keep them from ever having to do that. And so by having the access that our patients have, they're able to get answers to their questions very quickly and be able to know what we can do without having to have them seen by that higher level that takes longer, is more expensive, things like that.
So, Dr. Burns, that's interesting because access is key, all right? And, the tendency, especially with those of us that are a little older, is I think I'll just wait and see how I do in the next day or two. Or let's just, I didn't do that. I knew when I came back, something was going on. I rolled into that Advent ER at 5 a.m. to make sure where I was. But why is that not a good idea? And how important it is that they can reach out to you in the same day, say, I'm in trouble, I need to come in, or I think I'm in trouble.
Right. So here's the question. Do you have a primary care physician?
That helps.
Do you have a doctor? You went to why did you go to the ER?
Yeah.
Either because you don't have a doctor, like 82 million Americans, as 25% of the population of the country doesn't have someone that they can say is my primary physician. And if they do you have your doctor's cell phone number and you can call them directly to get care whenever you want to?
No, I would have to get an appointment,
right?
And I would have to wait.
So either you wait and you get well, or you wait and you die, right? Or you go to the emergency room or somewhere that is terribly inefficient, and you overutilize these emergency or specialty physician services because you don't have access to a physician who knows you and is available when you need them.
Yeah, and so there are two things there that are really important: knows you and available. So the average primary care physician in a major practice handles 2,500 patients, roughly. Okay, your model is significantly different, which means, A, you have more time, and time is critical. So talk a little bit about that, doctor.
I love the way that the model is set up. Because I know my patients, I understand a whole lot more. How much time are we going to need in a given appointment? What can we handle over the phone or telehealth or video calls versus what do we need to have patients come in for? And we also have easier, ability to make appointments for people. So if someone needs to be seen that day or the next day, we have the space. We are not completely oversaturated with patients that are coming in for 10-minute appointments. We have time with our patients.
Yeah, and actually the average time with the primary care physician in this country is 7.5 minutes, Doctor. Dr. Burns, you probably know that. Okay.
Yeah. Well, our practice, the practice model that we have, it's called direct primary care, cuts out the middleman. And when you eliminate the insurance middle piece, then we only handle about a third the number of patients that a typical insurance-based primary care doctor does. So we have 3 times as much time to spend with patients when they need us in the office and to be available whenever we're needed. I mean, literally, our patients can contact us 24/7 on our personal cell phones.
Yeah, I saw that. That's up on your website. I thought that was pretty interesting.
It's impossible to happen.
No, I do not have my primary
insurance.
She's great, but I don't have a primary cell phone. I call the nurse line.
Right.
You call the nurse line. That's what you do.
And you ended up in the ER.
Yeah, that's because I didn't want to wait to get an appointment 2 days later.
Exactly.
I wasn't going to fool around with it, so I did.
Exactly.
So you mentioned video. So you're doing virtual appointments, doctor. For instance, if you're a seasoned citizen, and there's snow on the ground and ice, you may not want to go out. So you have the ability then to connect with them. And I did a primary care visit follow-up, by the way, in the video. So you do that? Yes,
we have that option. We have a normal electronic medical record that we can use, as our way to communicate. But it's been smooth when we've had video calls with patients. We can also just talk on the phone or text. One of the nice things about our patient-specific texting program is they can send us pictures of rashes or say, is this infected? Do I need to, come in and get this checked out? And so there's so much more we can achieve with different modes of them being able to communicate with us that it saves the patient a whole lot of time. And
I just heard, you've got their cell phone number. They can text you, they can video. So there are 4 different channels here where they can reach out to you, and that is significantly different.
And they can be seen in the office on the same day.
And that's another big opportunity. All right, we're going to be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network. If you want to learn more about this practice, it's unique, it's something different, you probably should take a look at it. The website is ProPartnersHealthcare.com. ProPartnersHealthcare.com. They've got clinics around Kansas City. We'll talk about that coming up. The phone number, 913-451-4776. 913-451-4776. Stay tuned. We've got more. The doctors are in the house. We'll be right back after the break.
The golden rule: treat others as you want to be treated.
I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. 14 podcast platforms. I'll go through them in the next segment. Also, YouTube. A lot of folks following us on YouTube. A lot of folks up on the podcast platforms downloading these shows. And it's great because, you hear this show, you want to tell somebody about it. Maybe you want your husband or your wife. Maybe we got to think about this. Maybe this is a different model for us. Well, you don't have to explain it. Go to the podcast platform, go to YouTube, put up America's Healthcare Advocate. It comes up. You can watch the whole thing right there, just like we did it here in studio. All right, in studio with me, Dr. Troy Burns and Dr. Angela Prato from ProPartnersHealthcare.com. We're happy to have them here, and we are talking about a very different model of primary care. And as you know, primary care in this country can be a challenge. You heard doctors say, why'd you go to ER? Because I knew I wasn't going to get in to see my primary care doctor. It was going to take a couple days if I'm lucky. All right. So I chose to go because I wanted to find out right away what was going on with me. So let's go back to something you said earlier. 82 million Americans. That's a lot of people. Don't even have a primary care doctor. So why is that important, Dr. Burns?
Well, there's several reasons why, and one of it is when you're sick, and another reason is when you think you're well.
Okay, I like it.
Right.
Okay.
So if you're ill, as we mentioned, in the previous segment, you're either struggling yourself and you either get well or you don't, but you typically wait longer than you should. Because even if you have a doctor, the hassles of reaching them by phone or getting into the office to be seen are difficult. And typically there's a wait time is 19 days for new patients right now in the United States to see a primary care physician. And then also once you're in the waiting room, you wait for an hour to see the doctor for a few minutes, and then you can't add an, oh, by the way, as long as I'm here, that's another appointment. And so when you're ill, you tend to put off getting treatment, which means you stay sick longer or have other issues. But maybe more important than that is the preventive side. And 92% of the entire population of this country has failed to have all of the high priority preventive screenings that they should have. So preventive screening doesn't happen if someone's not telling you what those screenings should be and encouraging you to get those things scheduled. The other side of preventive care is lifestyle, right? It's being healthier. So if someone isn't coaching you about your smoking and your drinking and your exercise and your weight and your diet and all those other things and keeping those on track and monitoring the effects of all of that, then people, not only are they less healthy, and die sooner, but they feel worse, and they spend a whole lot more money in healthcare than they would if they had a primary care doctor in the first place.
Because they're being reactive, not proactive.
Absolutely.
Am I right?
Yeah. There's a reason our practice is called ProPartners.
I got it.
Proactive partners in health. That's kind of who we are.
And it makes sense.
That's
so
right.
We'll use a real life example. Toby Keith, well-known country music star, has gone through a radical series of surgeries because he had colon cancer. I don't know this for a fact, but I'll bet you $1 to a donut, he probably never had a colonoscopy done. I mean, here's a guy who was young, superstar, whole 9 yards, probably never thought to do it. When you said you don't know you're sick, Go back to that. And I want to use that as an example. He's 40 years old, 45, whatever it is, the prime health, doesn't think anything's going on. Now, all of a sudden, if you've seen the guy now, he looks like a walking skeleton practically.
Right.
It's really sad because he's a great artist. I love him. But let's talk about that in terms of an example of why that's important, Doctor.
So, I mean, I think it's really important that patients have someone that's their physician that they can go to and they trust and can have time to explain why some of these screening tools that we use are so important, why it's so important. Because if they're seeing in a regular practice someone that they only get 10, 15 minutes with, their physician or their provider isn't able to say, look, this is why we feel like this is important. This is what we're looking for. And the reason why you're going to be healthier longer if we do this. And so having the ability to explain things and educate and talk with what the patient's preferences are, get feedback from them, it's a much stronger trusting relationship between the patient and the physician. And we're able to really achieve our ultimate goal, which is prevention of these things.
Yeah, so what I'm hearing you say is you actually get to know the patient.
Yes.
That's a little different, okay?
Yes.
If you're seeing 2,500 people, you're probably not getting to know too many of them, okay? The other thing is that I think younger people have a tendency to think, I don't need to fool with that. I'm 35. Do I really need a colonoscopy? Or I'm 45. Do I really need a PSA cancer screen? Why is it important to them to understand, yeah, you probably do?
Well, I mean, in general, we follow the USPSTF task force recommendations on what screening would for any given person. But we take family history into account. We take symptoms into account. Are patients having anything that may prompt us to think we need to do a screening sooner? Things like that.
An example of that, if you're looking at a family history and somebody has a history in their Ashkenazi Jewish history and they're at risk for the BRCA gene, which means they're at greater risk for breast cancer, how do you respond to that?
Well, we discuss family history. We do use all of the calculators that are available to physicians to say, okay, what type of risk are we looking at here? What is recommended for your particular genotype or ethnicity? And we'll follow those.
So then they are going to get tested so that they don't wind up in a situation where it's after the fact and now they've got breast cancer because first of all, they didn't even know they had it, okay, and they weren't aware that they were at risk because they were in a higher ethnic category, and number two, they never got tested for it.
Correct.
So you're able to do that because you're spending more time with them. And basically what I'm hearing, Dr. Burns, is you're drilling down to a level that most patients don't get to experience.
It can't happen in insurance-based primary care because of the volume. And the volume is there because that's the only way they keep the machine running. It's what's called volume-based primary care. What we practice is value-based. We don't make an extra dollar by turning the turnstile and seeing more patients. We make our money because the patients that we have that are members, because it's a very affordable membership-based practice, because they believe that we're worth going to, even though we don't take their insurance, and paying us every month, even though they don't use our services every month, because they know that we're in their back pocket.
And that's important. You're in the back pocket, and on top of being in their back pocket, you're available to them. And that, when you say in the back, literally, the phone is stuck in your back pocket. They can pick up
we
that.
Answer it. Yeah.
Yeah. And two things: they can call and you actually answer the phone.
Absolutely.
Yeah. And that's very, very different. That's a very different primary care model. So when we come back after the break, now we're going to go through the model. I want Dr. Burns to explain how this works. What is the membership? How does that work? How does it work if you're an individual? I've been a healthcare broker for 27 years, okay? How does that work with health insurance if you're on a high deductible plan? Can you put this plan in place? If you're on an HRA plan, we're going to talk about all of that, how they integrate all of that, and how you can have the best of both worlds if you want to partner with ProPartners Health. The website, if you want to go to their website and learn more, and there's a lot up there, is ProPartnersHealthcare.com. ProPartnersHealthcare.com. Phone number, you want to call them, just go over, take a look, maybe do a visit. 913-451-4776. 913-451-4776. We'll be right back with more after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere. welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My always perfect producer, Mr. Darren Wilhite, behind the microphones at Odyssey. He's shaking his head, but he really is always perfect. And Mr. Dave Thiessen, who handles all of the video production on the 14 podcast channels and YouTube. And those 14 podcast channels are Spotify, SoundCloud, RSS Podcast, Overcast, Rumble, Stitcher, TuneIn, Pandora, that's interesting, Podcast Cast, Apple Podcasts, Spreaker, Amazon Music, Google, Odyssey, and also on YouTube at 257,000 views on there. And I think there's something like 66,000 of you that actually downloaded the show. So we appreciate you. And we're very happy that you go up on those sites and download the shows and listen to them and tell other folks about them. And we're getting we've been doing this about a year and a half with the podcast and YouTube, and it's kind of amazing how the thing is growing. And it always grows a lot when we have the doctors in the house. So we're happy to have Dr. Troy Burns and Dr. Angela Prato here. They are from ProPartners Healthcare. ProPartnersHealthcare.com is the website. All their information is up there. It's worth going to look at. We're going to talk about why here in a minute. In addition to what we've already talked about, enhanced primary care, we're going to talk about the model now. What does it cost? How does it work? And the phone number is 913-451-4776, 913-451-4776. Dr. Prato, before we get to that top, you did something off camera here on the break. Talk about that 24-hour physician thing that you talked about, because that's really kind of interesting.
There was a study within the last year where they had shown that in primary care, in order to achieve all of the goals and requirements or metrics, as we call them, as to screening and behavioral health interventions, things like that, you would need 26 hours a day of working solid for a primary care physician with a normal panel size to be able to achieve all of what is expected of them. And obviously, there are not 26 hours in a day, and physicians have to sleep. You can't possibly get everything done in that time. And so they're dealing with this overwhelming amount of expectations, just able to deliver what they can in the time that they're given.
Yeah, that's at 7.5 minutes, and they're seeing 2,500 patients, and they're in. Mm-hmm. So, Dr. Burns, you started doing this a long time ago. I've listened to you on radio for, I can't remember how long it's been. It's been a while. Mm-hmm. You started out with one clinic. You have two now, and you're opening a third one. Is that right?
This year sometime,
okay.
Yes.
So talk about the model. It is a pay model where you pay a membership.
Yeah.
You and correct me if I'm wrong, but if being a health insurance broker, if I were to send, and we've had people come to you, you do an HSA plan, you pay for it out of your HSA, it's tax deductible, hold on. Same thing with HRA. So there is a model where you can tie it to health insurance, so you have catastrophic coverage, all the rest of it. But talk about why you did this. You're an expert in it, obviously. It's a very different model. How does it work? What does it cost? And you do it for individuals and you do it for employers.
Well, the reason we made the change is because our current system is simply broken. Healthcare is broken in a lot of ways, but if we want to fix healthcare, we have to start by fixing what is the foundation, the front lines of healthcare, which is primary care, as we've already talked about. And they say that 40 cents of every dollar that's paid for primary care services goes to the relationship between the insurance company and the doctor. 40%.
That's the network access.
Yeah. So essentially, that middleman is what's causing this high volume practice that's out there in the traditional sense. And so I know you're a health insurance guy, but primary, insurance is designed for things that are expensive and unpredictable.
Catastrophic health care with HSA.
Primary care is neither expensive nor predictable. Unpredictable, right?
Right.
And so by carving out that middleman and that 40 cents of every dollar, that's what allows this direct primary care model to work and allows us to be available when people are needed.
So here's the thing you need to understand. If you do this and you look at the price difference between an HSA and an HRA versus a silver plan, a gold plan, whatever the case, or a bronze plan even, with any one of the carriers that are out there, go through all the book of carriers, there's a huge difference in premium. What he's saying is that if you put that money back in your pocket, all right, and what Dr. Burns saying is you adopt their model, you're cutting out that whole issue to deal with that. And oh, by the way, you can pay for your primary care using the HSA. So talk about what it costs and how that works.
Yeah, essentially high deductible plans, they leave you with more out-of-pocket expense. But the things that they're leaving you to pay for are office visits and co-payments and ancillary services that are typically included or heavily discounted in the direct primary care model. So your savings that you get in your premiums by going with a catastrophic plan far outweigh and exceed what we charge for that primary care piece.
Yeah,
so you can have the best of both worlds by doing a high deductible health plan with direct primary care.
So talk about what this costs. I want to come in. I want to sign up. What's it going to cost me a month?
Essentially, the cost of a cell phone bill. It's for less than $100 a month for most people. We for retail members or patients of our practice, it's tiered based on decade of life. So $35 for kids up to a maximum of $115 per month for people over 60.
So that'd be for us seasoned citizens.
Right. So, it averages out to about $85 a month for unlimited access to Dr. Prato. So you have your doctor who knows you, is always available. You never pay for an office visit charge. You don't pay co-payments and deductibles. You get at-cost labs, which is about a tenth of the cost of retail and about a third the cost of insurance adjusted prices. Same thing with imaging. We've contracted with the imaging centers all around town to provide at-cost X-rays, MRIs, CAT scans, mammograms, all of the imaging. And your co-payment for an MRI of your knee might be $600, $1,000 if you're lucky. In our practice, it's less than $300 for an MRI of your knee.
So basically what you're doing is you're letting people save those dollars and make their own decisions.
It's a straight pass-through. And, also what that does in our model is it allows us to be aligned with our patients. So they know that if we say we need you to come into the office rather than doing it over the phone, it's not because we're making more money by them coming to the office. We don't make a penny. So they know it's because they need that. If we order a blood test or an MRI or refer them somewhere, we don't make a penny. The labs, it's a pass-through. We make nada when it comes to all those things.
So you're basically facilitating them. Go back to time again in the previous discussion in the last two segments. You're facilitating them to allow them to get better care, but they're actually doing it and saving money at the same time they're doing it.
And one of the best aspects of this that I think is we can do whatever is best for the patient. Like, we are there to help them. And so if they want to use their insurance, we'll send their insurance for their mammogram, so that's free. For their screening things that insurance will cover without them having to meet their deductible. So if they haven't met their deductible yet, they don't plan on seeing any specialists that year, we talk about price. Like, here's what a cash price would be for this. But if you want to go through insurance, we can. Just know that you're going to probably end up paying more unless it's one of those preventative services.
Or if you're on 26-year broker talking here, if you're on an HSA, you can turn around and pay for the whole thing right out of the HSA account. It's tax deductible coming off, okay? And you don't have to go through the pre-cert. You don't have to go through any of that stuff. And you can go to one of your facilities where, if you're out of pocket, for these kind of services is $1,000, you're going to pay that full $1,000. That's the way it works. On the other hand, if they're doing it with the way you're doing it, they're getting it at a steep discount. And the labs, it's basically a pass-through on your part. So you're facilitating. They don't have to go figure out how to do all this. You're doing that for them.
Yeah. You're the healthcare advocate. We're healthcare advocates for our patients. That's essentially what we do. Is we're the Sherpa that helps them navigate the entire healthcare system. So if it comes to a referral or how to get their prescription medications at the best discounted prices, we have the time to coach them on those things. And so, I'm convinced that I save probably the majority of my patients more money than they pay me every year just by the coaching on medications, the discounts on labs, the discounts on imaging, those kinds of things, let alone the medical services that I directly provide. Yeah,
and the quality of the service.
That's
Again,
right.
Dr. Prato, I keep going back to this because it's the key to the whole thing. You're not doing 2,500 patients, okay? And you're not spending 7.5 minutes with an average patient. They've got time. And, I like it. He said, we're in your back pocket. you got their cell phone number. To me, that's pretty unique, okay, because I don't think there's any other practice out there that I know of that allows it. If you want to learn more about how all of this works, the website is ProPartnersHealthcare.com, ProPartnersHealthcare.com. The phone number, 913-451-4776. Go up on the website, take a look at them. You might be surprised what you learn. When we come back from the break, I'm going to ask Doctor to talk about the employer model. So now you're an employer, you're a small business, you're getting hammered. You're getting 22% increases, 37% increases. Remember, I've been doing this for 26 years on the healthcare side. So I understand that. Let's talk about what the alternative looks like with ProPartners Healthcare. We'll be right back with more. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Doctors are still in the house. Stay tuned. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. My producer behind the microphones, Darren Wilhite, and my producer behind the camera is Mr. Dave Thiessen. Dr. Pern's book, Medical Answers Now. You can get a copy of it. Is it up on Amazon, Doctor? All right, it's on Amazon. You can probably get one in his office if you choose to go. So an opportunity here to learn about this model, why he did this, and how it all works. So Medical Answers Now, Dr. Troy Burns' book. Joining me in the studio, Dr. Troy Burns and Dr. Angela Prato. Let's go back to something. Actually, Darren brought this up off air a minute ago. How do the prescription drug parts work with this program?
So some direct primary care offices will dispense generic meds out of their office. We've chosen not to, just because so much changes with the supply and the complications with how things are with generic medications. And so we will work with patients to try to find the best price for them, whether that be going through their insurance, they go to CVS or Walgreens, but we also have the option to look up what the cost would be cash price. If, say, it's going to be $150 with their insurance, we can just look and say, okay, GoodRx says that at Hy-Vee, it's only $6 for this prescription. And so if you're not going through insurance, you can just pay the $6 and not have to mess with the $150 that you would be paying using your insurance.
So you're providing with information to make better decisions.
Correct.
That's really what it comes down to. That's kind of interesting. Doctor, let's talk about employers. Mm-hmm. Small groups are getting hammered. You heard me say it in the last segment. You know, we're seeing increases 21, 28, 27, 30. I mean, it's ridiculous what's happening. A lot of that's being driven by people being forced into the ACC Obamacare model, which when they brought this out X number of years ago, I said this was going to happen, and it's happening. And so you've got government-controlled healthcare now. You've moved insurance carriers to basically being utilities, and you're telling them what they can and can't do and what they can charge, and the prices continue to go up. So talk about your model and how that contrasts with that for small employers particularly.
Yeah, I mean, as you've alluded to, you know, every business is a healthcare business now, right? It's the second or third largest item in their budget is care. Yep. And health insurance isn't health care, right? They can get the most expensive health insurance, and they're still leaving it to luck if their employees are even going to have access to care when they need it.
Or they're one of the 82 million that don't even have a primary care doctor.
Yeah, insurance guarantees that certain things will be paid, but it doesn't guarantee access when you need it. And so I think that's the intuitive appeal for guaranteeing employees primary care. It's great for retention. It's great for loyalty. Employees see it as a premium benefit to have guaranteed primary care with practice like ProPartners. And so then, you know, if you know that you have guaranteed your employees primary care directly with a physician group like ours, then you have so many other options of what you can do with the insurance piece. And you know, someone once said, if you like your doctor, you can keep your doctor. But then if you change your insurance plan and your employees' doctors aren't participating, they lose their doctor.
That's right.
If you lock in with the doctors directly for primary care, if something is better for the employer in terms of changing their insurance piece around, they can change it all they want and never disrupt that primary care relationship with employees. So we have probably, 15 or 20 different companies tiny companies, large companies. You're repping the Kansas City Chiefs there. Joe's KC Barbecue is one of our clients.
Great barbecue, by the way.
Life Church here in Kansas City. National Beef, another where they get their barbecue, right? From the cows. So National Beef here in town, and a number of other employers have said, we want to guarantee the primary care piece and then go with some kind of insurance that either carves the primary care pieces out.
Just say HRA.
Just goes with high deductible and then has discretionary spending.
So how does that price out? Just as some example of, is it scaled based on size?
Well,
or is it basically
with employers, it's $85 per employee per month.
Okay.
And $85 for a spouse. Or all kids that are 17 and under.
Right.
Or family maximum $220, I think.
Okay.
$240, something, $220. Okay. $220 per month. So that's a tiny fraction of what they're paying for insurance, even with the high deductible health plans.
Yeah, the annual premiums run anywhere from $600 to $800 to $900 a month. I mean, my daughter in California right now, who's an attorney, is $2,000 a month. She's paying.
Yeah.
Her law firm's picking up half of it. She's paying $2,000 a month for a Blue Cross plan. So when we talk about cost, they're like, I don't know, 50 lawyers in that in her practice. So when you talk about cost, $200 a month is pretty reasonable. Okay, if you will, for a family of four to be able to have unlimited. Primary care. Now, there's an interesting example of this. Years ago, I did a series of shows with people down at Quick Trip in Oklahoma. And one of Quick Trip's key things about employee retention and why they are able to keep people in those stores, they have their own primary care clinics. There's one right over here on Metcalf across from the RPS Benefits by Design office. And it fascinated me because they have access to the thing 24/7. If you're not open 24/7, but they have the same models similar to what you do. But when I talked to the HR VP and how it all worked, he said, this is one of the key reasons why people stay with us, because they have unlimited access to this primary care for the whole family. They don't have any copays. They don't pay any. They just walk in. Okay, they're there. And so what you're basically doing is taking a model like that. Okay, your model, I think, was ahead of them.
Yeah, I was going to say they're taking the
you were there before they were.
Yeah, 96 is when the first direct primary care started. But what's amazing
about it is the way they feel it has changed the structure of their employees.
No doubt.
And the loyalty, because as you said,
that's right.
It's the number 2 cost behind payroll.
Right.
Okay, and it's a huge issue. People literally can't afford it. A lot of times what will happen is the employee will get health insurance, but he can't pay for it for his family.
Right. There's a study that was done a while back. It was NYU and Johns Hopkins, and it was a literature review, and they reviewed 157 published studies that looked at primary care and the effect of unrestricted more primary care on health and patient satisfaction and on cost. And the more interaction with primary care, the better the satisfaction, the better the people's health is, and the less it costs.
And that is exactly correct. Thank you both for being here.
Thank you.
Great show today, great opportunity. If you want to learn more, and it really is worth taking a look at, ProPartnersHealthcare.com, ProPartnersHealthcare.com. Phone number 913-451-4776, 913-451-4776. You know, I do these kind of shows for a reason. I'm trying to expose you to other opportunities that are out there in the healthcare field, regardless of what it may be. And that's why I brought them in here today. I hope they'll come back. I think there's a lot more to learn. This is an opportunity to have better healthcare, and I think you might find this interesting. So once again, the website, ProPartnersHealthcare.com. And now I leave you with this thought from Dr. Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.